Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question from one of our readers, and the question last week was, my dad's prognosis is poor according to the doctor, but who is really directing his care? Help. You can check out last week's question by clicking on the link below this video. In this episode of Your Questions Answered, I want to answer a question from one of my clients, Anna, as part of my one-on-one consulting and advocacy service. Anna's dad was rushed back to the hospital due to an infection, and the medical team wants to place him on a DNR or do not resuscitate status. Anna is asking for help to manage the situation appropriately for her dad's condition. So today's question is, the medical team wants my dad on a DNR, do not resuscitate status. What should we do? Help. So these are excerpts from email consulting and advocacy sessions with me and Anna. So I'm going to read them out for you. Anna writes, "Hi Patrick, thank you so much as always for your advice and support. Sorry it's taken me a while to respond. Dad is back in hospital. He was admitted via ambulance. My brother visited him at home and that morning and was really concerned to find him in bed and delirious with an inability to speak. My stepmom felt it was due to the consistently high blood sugars and that it would resolve. She was in daily contact with the diabetic team helpline. Fortunately, my brother urged her to question this and to ring for an ambulance. The paramedics took him in straight away. The working diagnosis has been pneumonia and sepsis. Things looked perilous that day, and the consultant and matron told us they wanted to place a DNR or do not resuscitate if he had a cardiac arrest. I used everything you have taught me not to be rushed into making decisions to advocate for Dad. ICU reviewed him and said they wouldn't readmit him. Said there was nothing they could do that would be in quote unquote his best interest. The ward consultant said we may reach a point where we have to accept he's not going to make it or is dying, but that they would continue to offer all treatment in the hope he would respond to antibiotics and steroids. My sister and I have learned through your counsel and consulting to think carefully, ask questions, consider the viewpoints of the medical team, and not to be rushed to make decisions which might prove critical. Regarding the DNR, I sought clarity. What does this actually mean? Would you try to resuscitate or not even attempt? At the time he was very unwell. They said, is it fair to jump on his chest? Is the outcome likely to be negative? I said, well, the quality of the CPR, if he arrested, would be my big question. How quickly would a response happen? How at risk would he be of potential brain damage? They said they would act and crash team would immediately come. That they would try to resuscitate, but if clear it's not working, they would stop. In the end, we said, okay, well, Dad has had plenty of opportunities to go before and he hasn't. If he arrests, it may be his natural choice to go, but we review it in the morning. They agreed. Fortunately, he made it through the night. He was exhausted the next day, slept all day and still a little bit delirious. But by Friday, he was awake and sitting in his chair. He's still on oxygen, but it's coming down. Sodium levels now normal. Blood sugar still high and erratic. I'm going to purchase another email consulting package to get your advice on how to manage this whole situation. We have maintained our position as advocates and reminded them it's their duty to treat my dad to the point where he can make decisions for himself. If possible, and fortunately we are at that point again as he can communicate. Although, of course, he's still not out of the woods. So, there is still the unresolved issue of his ongoing diarrhea, unchanged since admission to ICU, as you know. He is nil by mouth due to the dysphagia, as you know. peg fed since November after the nasogastric tube debacle, which you know well too. But actually it's clear Dad has not been receiving adequate levels of hydration or nutrition, or indeed absorbing his insulin. On admission to hospital, he was dehydrated despite my stepmom administering the feeds correctly, including flushing, etc., and had lost weight. For the 3-week period he was at home, his blood sugars were 30 to 35 daily. My stepmom was on the phone every day to the diabetic team, who used to advise upping the insulin, but then started to speculate that he wasn't absorbing the insulin as he was so fatigued. Thank you so much for everything that you've done for us. I'm also not sure if I told you the MRI done on the 5th of December showed 2 old strokes, which the stroke consultant told us have resolved well. 2 microbleeds and microvascular ischemic disease sitting in the pons area of the brain, and likely cause the dysphagia and voice atrophy, we have been told. Dad is feeling much better today. He was sitting out in the chair. He's still on oxygen cannula, but at a reduced rate, and oxygen saturation is unaffected. He's alert and unable to communicate. He is remarkable and surprised the clinicians once again. But of course, in the back of my mind, I always worry how much Dad can take, this poor man. Also, we applied formally on Dad's behalf. He signed the form for copies of all of his medical records, including the doctor's written notes, but they have only sent us radiology images, some charts, but not the nursing or medic narrative that we know exist. Should we be able to access those? Without the medical or doctor's notes, it's impossible to track the decision-making and narrative. Obviously, the request came from Dad himself as well. Many thanks in advance for your help. From Anna. So here is my response. Hi Anna, thank you again for being a client. I really appreciate your support. I'm very sorry to hear that your dad is back in hospital. I do understand that he's not in ICU and the ICU team is involved, but they don't want to admit him at the moment, and they do want to place a DNR order form from what you are saying that your dad has been diagnosed with pneumonia and sepsis. My question is, how are they treating the pneumonia and sepsis? If somebody has sepsis, there's a high chance they need ICU. So you may want to clarify if it's really a sepsis or whether it's just a pneumonia/infection. You also want to find out if they really place a DNR on your dad or not, because sometimes they say, oh, they might want to place a DNR, and in fact it has already happened. So you may want to get evidence that they haven't placed a DNR. You should definitely advocate for your dad to go into ICU if he needs to. Now here's the other thing, you may also want to look at things like, what are your dad's vital signs? Starting from the top, you really, you mentioned he's not talking from what I remember. I do remember the speech therapy involved in the past, and I wasn't sure, or I'm not sure at this stage, if he was able to talk or not. Then next, how are his vital signs? Is he in a regular heart rhythm, like a sinus rhythm? I do believe from memory he was in atrial fibrillation or AF in the past. What are those vital signs showing? Is his ECG and his blood pressure normal? And most importantly, with pneumonia, what is his respiratory status? For example, what is his oxygen saturation like? What is his work of breathing? How fast is he breathing? How slow is he breathing? Is he able to take deep breaths? Is he able to only take shallow breaths? And so forth. Using his respiratory muscles, or is he using his abdominal muscles because he can't breathe properly? Also, is he on high flow oxygen? How much oxygen is he on? And the list goes on. Those are very important questions. Would he benefit from BiPAP? You've seen BiPAP in the past with the mask. Would he potentially benefit from having a tracheostomy inserted temporarily? Is he able to cough up all his secretions? Those are very important questions. What are they doing for the pneumonia? Are they giving him antibiotics? Have they done a sputum sample? Do they know what they're treating him for? Is he getting chest physiotherapy for the pneumonia? Also, with the sepsis, Often patients can go into kidney failure, and I do believe your dad has been in kidney failure in the past from memory. So those are all questions, because the sepsis can easily shut down the kidneys, and therefore, you may want to ask whether the kidneys are okay. You're also saying that ICU, they reviewed him on the ward and they said they wouldn't readmit him. So, Anna, you got to talk to them over and over again and tell them that you want your dad back into ICU and that you decide what's in his best interest and not them. Also, if your dad is awake, ask him what he wants. Ask him whether he wants to go into ICU or not. And then, make sure that they know what your dad wants. You're saying the ward consultant said that we may reach a point where you have to accept he's not going to make it or is dying again. That they're always negative and that they're always painting the worst case scenario picture and they're always doom and gloom. But I wouldn't be worried too much about that, and I would just go with advocating for him. You mentioned antibiotics and steroids. Again, the steroids would impact on the sugar levels as well. How do they control the sugar? Is it insulin? Is it tablets like metformin? Is it diet controlled, or is it a combination of all of the things that I just mentioned? You are also saying that through my counsel, you need to think carefully and ask questions. Consider the viewpoints of the medics and not be rushed to make decisions which might prove critical. So therefore, you're absolutely right with that. Keep standing your ground. Therefore, you need to make sure that your dad can go into ICU anytime if needed. Regarding the DNR, you sought clarity. What does this actually mean? Would you try to resuscitate or not even attempt it? I can't answer that question for you, Anna. However, again, if your dad is able to make a decision, ask him. Ask him simply if he wants to be resuscitated or not. And the decision should be made by your dad, right? They say it's not fair to jump on his chest again, but simply ask your dad. Yes, the outcome is likely to be negative potentially because your dad has been through so much. But if he survived 7 or 8 cardiac arrests, why could he not survive another one? You've got to ask those questions. The risk would be of potential brain damage. Yes, you know that. If there is significant downtime during CPR, yes, the risk for potential brain damage is there. But again, it's all hypothetical at this stage. You then said they would act if the crash team would come immediately. Yes, that would be necessary. And if it's not clear, they would stop. They would stop CPR, but that's why you need to make sure that there is no DNR in the first place, period. You need to make sure that there is no DNR so that they will do everything that you want them to do at this point in time. Anna, they're clearly pointing out your dad has had plenty of opportunities to go before and he hasn't. And that's what you should base your judgment on. And if he arrested, maybe a natural choice to go. But why would you do that if you don't want that? Again, leave it up to your dad. So you now shared with me that he made it through the night. You need to make sure that there is no DNR, and by Friday he was awake and sitting in his chair. That looks good in that picture that you sent me. You keep asking your dad what he wants. That is the most important thing. You're also saying that blood sugars are still high and erratic. Yes, make sure he's getting some feeds, regular feeds, and also have a look how much steroids he's getting. He's getting lots of steroids. His sugars will be through the roof. You need to maintain your position as advocates, and you definitely need to remind the ICU team and the doctors that you want everything to be done, including sorting out the sugar issues. It's their duty of care to treat your dad, as well as you as a family, to the point where he can make the decisions himself. It's what I said all the way along. But even though he's not out of the woods yet, you would definitely want to make sure that there is no DNR and he can go into ICU if need be. Now you're talking about unresolved issues of ongoing diarrhea since admission in ICU in May. Have you consulted a dietitian or a gastroenterologist? Is he getting gastrostop to counteract the diarrhea? Especially with diarrhea, he will also need water to stop him from dehydrating. He's still nil by mouth since November, and I do remember the nasal gastric tube debacle. you know it's clear that your dad has not been receiving adequate levels of hydration or nutrition, or indeed absorbing his insulin. Can you share with me how much hydration or nutrition he has been getting? If he was dehydrated, can you give me an idea how much fluids he's had or how much he's getting every day, and if he's lost weight? There's a good chance he's malnourished, and you certainly don't want that. The sugars were 30 to 35 daily. That's incredibly high. It needs to be sorted while he's in hospital. The sugar and the insulin needs to be sorted. Get an endocrinologist involved. High sugars at home are a huge risk for hospital readmissions. He's in hospital, but that's the best way to get the sugar sorted, because that could get your dad to bounce back into hospital if he's at home and the sugar's up and down. So if you can clarify those issues, and then, I can respond to that. You're thinking he wasn't absorbing the insulin as he was so fatigued. I think insulin absorption should be pretty steady. I would hope. You're also saying that the MRI done on the 5th of December shows old strokes and microbleeds, as well as microvascular ischemic disease, but he's feeling so much better today. He's sitting out in the chair and is on an oxygen cannula, but at a reduced rate, and oxygen saturation is unaffected. He's now alert and able to communicate. That is remarkable. And he surprised the doctors once again, but you still need to make sure there is no DNR in place so he can keep surprising the doctors. And you need to make sure he can go back into ICU if and when needed. The voice atrophy you referred to in your email, I believe, could be a result of prolonged tracheostomy. Dysphagia could be a result of the stroke, but also of a prolonged ICU stay. Is he still getting speech therapy? Last but not least, Anna, you will need to make sure your stepmom will get some support when your dad is going home as well. What about hospital in the home type service? A nurse coming at least once a day to check sugar levels and give your stepmom a hand by assessing your dad. It's a vital necessity going forward. Ask the hospital. They will need to sort something out. They certainly don't want your dad back in the hospital. Always check in with your dad. As long as your dad isn't giving up, neither should you. Last but not least, Anna, you will definitely need the copies of all of his medical records. You need to keep pushing for that. You need to keep pushing for the medical records. You will need to access the medical records to ensure no DNR and ICU access when needed. And if the request came from your dad, that's even better. So if you can answer some of my questions, then I can get back to you and guide you further. Thank you. So, how can you become the best advocate of your critically ill loved one? How can you make informed decisions, have peace of mind, control, power and influence quickly whilst your loved one is critically ill in intensive care? You will get to that all-important feeling of making informed decisions, get peace of mind, control, power and influence when you download your free instant impact report now by entering your email below. In your free instant impact report, you will learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free instant impact report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free instant impact report now by entering your email below. In your free instant impact report, you will learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care, and how your critically ill loved one's treatment may depend on those competing interests, how to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You will get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power and influence in your situation. You will get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind-the-scenes insight so that you know and understand what is really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also have a look at our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Also, have a look at our membership site intensivecaresupport.org for families of critically ill patients in intensive care. You can also call me, find phone numbers on the top of the website. Also, have a look at our ebook section where you get more ebooks, videos and audio recordings, and where you can also get one-on-one consulting and advocacy with me over the phone via Skype, via Zoom and via email. Thank you for watching this video. This is Patrick Hutzel from intensivecarehotline.com, and I'll talk to you in a couple of days. Take care.